Hello everyone. Today's topic is body composition analysis with BIA method. BIA means bioelectrical impedance analysis. I happen to be a committee member of the Society of Korean Medicine for Obesity Research in Seoul, Korea from 2005 to 2011. And I published some researches using BIA method to assess obesity, including clinical studies. These are all clinical studies. So I would like to talk about very basic theories regarding BIA method and how to properly use BIA method to assess obesity. And first, let's start with what is BIA? BIA is a tool measuring body composition. The electrical signal passes quickly through water that is present in hydrated muscle tissue, but meets resistance when it hits fat tissue. This resistance, known as impedance, is measured and input into scientifically validated equation to calculate body composition measurement. This is from manufacturer's website, Tanita, Japanese company. So the keywords here are equations and calculate. That means this is not the direct measurement of the fat. All this device measures body composition with BIA method. The shapes are different, price range is quite different, but basic principle is same. This is from Japanese company called Tanita, and this is from Korean company called InBody. And I have been using this InBody machine more than past 15 years until now. 3 different kinds of InBody machine. So I will more focus on this machine. And this is the result paper produced by InBody, and this is the result paper produced by Tanita. They look quite different, but actually what they say in these papers are quite similar. Next, how to measure. The BIA method is very sensitive to hydration of the body. This is the essential part. For accurate check, the BIA test should be done before meal and after urination, not after exercise, shower, or sauna. This is mandatory, and patient is advised to stand still for 5 minutes before test, but I don't think this is a very practical advice. And room temperature can affect the hydration of the patient's skin, and not during the menstrual cycle. Women in menstrual cycle tends to have more water retention. So you should follow all these advices to get accurate result. And accuracy wise, historically, BIA technology have been met with some degree of skepticism. And this is true, because BIA method itself is not a direct measure of the percent body fat. So the company says the InBody technology addresses these concerns with its technological features and provides great precision and accuracy for total body and regional measurement. And the InBody is considered to be approximately 98% accurate when compared against DEXA. But DEXA is not the best measurement of percent body fat, so this comparison is kind of misleading. Usually, hydrodensitometry method is considered as a golden standard of the measurement of percent body fat. But BIA method is way more convenient. You don't need a pool. And percent body fat in women, usually 31 percentile, less than 31 percentile is considered as acceptable. That means normal. In a man, 25 percentile is considered acceptable. So 1/3 of body or 1/4 of body is consist of fat. That is quite normal. And in a woman's case, if the fat is less than 10%, that can make a problem like a delayed menstrual cycle or pregnancy and other endocrine problems. How to interpret the result? To interpret the result properly, there are few information you need to understand first. First one is lean body mass and fat. Our body consists of lean body mass and fat. Fat is very straightforward. Then what is lean body mass? Lean body mass is soft lean mass and hard lean mass. Hard lean mass mostly bones, so soft, hard. SLM and minerals. Those are lean body mass. And soft lean mass consists of body water and protein. So mostly muscles. Muscle water. So to speak, water, protein, bones. Water, muscle, bones. Water, protein, minerals. Those are the components of lean body mass. And water consists of intracellular water and extracellular water. So we call this component as a body composition. First, lean body mass, fat. Soft lean mass, minerals. Body water, and protein. Those are basic components of our body. This is the result of BIA test examination from InBody here. And you can see all the components we just learned in this paper. First, there is intracellular water, extracellular water, and dry lean mass, lean body mass, and body fat mass here. And here, weight and skeletal muscle mass, that is a part of lean body mass and body fat mass here. And here, BMI, this is another calculation based on your weight and height and percent body fat. And if you see here, segmental fat analysis, so fat distribution in right arm, left arm, trunk, right leg, and left leg. And this number here is kind of funny. Fitness score. This is the score based on this company's equation. So it represents how fit you are. But I don't take this seriously. This is called visceral fat level. So quite interesting. This device can calculate the visceral fat without taking MRIs or just without measuring your waist circumference. Next, it shows the segmental lean analysis tool. This one will analyze the distribution of water in arm and trunk and legs. See? And here, extracellular water and total body water. So in this paper, you can see all your body composition in detail. But most important measurement in this test result is this one, percent body fat. This is the main reason we went through this test. And this is water and this is fat. With different conductivity of electricity, the impedance value, with the impedance value, we can calculate the ratio between water and fat. And this is the result. And based on statistics and equation, it also calculates the body fat mass, absolute weight of body fat mass. Based on the patient weight and the percentile of the fat, it can calculate body fat mass. And this number, which is called impedance, is maybe the most important numbers in this paper. It is written in very fine letters, but this is what actually they measured. So it is segmental: right arm, left arm, trunk, right leg, and left leg. Because this device has 4 different contact points in a hand, both hands and both feet. So segmentally, they measure the impedance. So based on this different value, they calculate the segmental limb distribution and segmental fat distribution. And you can see here different frequencies. Based on this difference between frequencies, you can tell if the patient have more extracellular water. High frequency electricity conduct well both in extracellular water and intracellular water, but low frequency electricity have a tendency to flow through only extracellular space. So only the extracellular water conduct electricity in low frequency. So edema is an abnormal accumulation of extracellular water. That means when they have more water retention in extracellular space, they have less impedance value. That means more conductivity. Low impedance, higher conductivity. Okay, let's go back to the result paper again. So we can see that the difference between higher frequency and lower frequency. So it is supposed to be true that in a higher frequency, impedance is lower. And in lower frequency, impedance level is higher. So if you see here, all this number is greater than these numbers. But when the patient have an edema, this difference is lessened because there are a lot of water retention. Even in a lower frequency, electricity can conduct well through the extracellular water. Based on this difference, this device calculates the extracellular water and total body water. So when this number is higher, usually we can say the patient have an edema. It can be partial or it can be systematic. In this patient case, this number is out of normal range, just slightly. That can mean this patient is dehydrated. So this is the summary. BIA device measures first fat and water ratio, so percent body fat, by comparing electrical impedance, difference between muscles and fat. And second, extracellular water and intracellular water ratio, by comparing difference frequencies and its impedance. So these two measurements are the most important numbers in result paper. Beside those two results, all the other numbers are calculated based on their own equation. So those numbers like visceral fat and fat distribution or lean mass distribution, those numbers are all indirect calculation. This is the most valuable part of the BIA. And this is super convenient. You don't need a pull, you don't need the MRI. So this is a very convenient tool for measuring patient percent body fat. So with BIA device, you can easily measure patient percent body fat, PBF. And we usually think percent body fat is better tool to assess obesity or overweight than body mass index. Body mass index is a simple calculation with the height and weight. And this is a measurement of appearance. And this calculation is too sensitive to muscular body build, especially a very fitted man. And percent body fat is the measurement of fat percentile. In contrast to BMI, this calculation is sensitive to skinny female. So this result is too sensitive for skinny female. This means even though PBF is higher than normal, if the subject is skinny female, it is more like she is not obese. Here are interesting two cases. First, this guy. If you see this guy, very fitted. And if you see his BMI out of normal range, can you say he is obese based on this? But he has extremely low percent body fat. So his slope goes like this. How about her? Very skinny lady. Her BMI is very low, but her percent body fat is over the standard range. Can you say she is obese? So based on BMI, he is obese. And based on percent body fat, she is obese. So with this fitted man, BMI gave a false positive. And with this lady, percent body fat gave false positive. So none of the tests are perfect. They have pros and cons. And please remember that percent body fat is not representing the obesity or overweight 100%. Sometimes BMI can be a better option, or MRI or DEXA or skin fold measure or simple weight circumference measure can be a better tool. And there is well-known limitations in BIA method. The BIA method usually apply reliable result for a dominant population like obese adult. But how about the children or adolescent or severely obese persons or not that dominant ethnic groups? In those populations, BIA method can be less reliable because lack of statistics. Before we wrap this up, I would like to remind you what is obesity again. Obesity is the condition with excessive fat accumulation. Without excessive fat accumulation, you cannot say your patient is obese or overweight. So please do not overuse the term skinny fat. Percent body fat through BIA method or weight circumference or BMI, those are just tools with pros and cons. You can utilize these tools properly and interpret the result properly by understanding their principles. I hope this clip helped you understand the principle of percent body fat with BIA device and help you practice too.